the social sector. How do you marry the most basic health needs with the most advanced technology? Simple? Not quite. Doable? Most definitely. I'm standing outside a tiny slum in Kirtinagar, Delhi. For people from poorer backgrounds, reaching a doctor is often expensive and difficult. The eHealth initiative wants to bring people healthcare that's affordable and accessible. This is how 70% of India lives, in conditions of abject poverty, poor sanitation, malnourishment and almost no access to basic healthcare. The public health system also seems to have let them down. What makes matters worse is the ignorance that prevails.
Specifically, difficulties in the area of awareness about the diseases and family planning, cleanliness, and then naturally financial property, financial problems with the people who are coming here, and lack of knowledge.
It's been active in Sirsa, Haryana for over a year now, and Digital Partners is trying to extend that network to PHCs like this one, the Prayas Health Center.
We created something what I call basic system that can capture the patient care data on the web. Basically, it means that no matter where the patient goes, we can take the data. And that's how it began. It has gone all the way up to Stockholm Challenge Award finalist in 2004. And I think it has created at least awareness of what can be done.
Each PHC is connected to the eHealth software and they computerize all health-related data. That leads to the creation of a comprehensive health profile for each individual. The data is then available to registered medical professionals when required. When patients approach the PHC for the first time, they are issued a health card and that contains a unique identification number. This accesses their profile and is a critical source of information during emergencies. It details everything from blood group to serious diseases like diabetes and epilepsy that could influence treatment. And all it costs is 5 rupees.
In Sirsa, primarily the idea was, if patients do not appreciate this as much today because they don't know this, let's give them a health card which will have a picture, some data. So what happens is it excites the patients and also a proof of concept. Will they pay for it? So well, cost maybe 50 rupees, but will they pay at least 5 rupees? Yes, but how do you make it really beneficial to patients? Unless the entire back end is there, unless you create the databases and link them to every single stakeholder and make a process smooth, benefits will not start rolling down. But then there is a lot of resistance there. So Sirsa has been, we have 45,000 records, patient records as of now, at the first preliminary or next or 2-3 visits levels.
The patient is also issued an appointment card that he or she presents to the doctor. The doctor then prescribes medication and marks it on the appointment card. The patients present that appointment card to the PHC operator, who in turn updates the database with the latest information. In some cases, the local doctor may refer the patient to a specialist in a different area. The PHC operator can make an appointment for the patient online. This is especially useful for patients who may have to travel 50 to 60 kilometers to a specialist hospital and would otherwise wait all day to be seen.
The basic idea is that patients in the villages do not remember very much. They may not know their age. They may not know what happened to them last time when they came to the doctor. They may not find appointment with the next specialist they have to go to. When they go to a civil hospital, district hospital, they have to wait too long. They may not meet the doctor for 2 days. Looking at the harrowing tales of patients, those who have to move from villages to the next block level or the community level or district level hospitals, or those who come to Delhi for ultimate treatment, etc. We thought one of the big problems is, which we can solve with the help of technology and managing process, is we can get them better appointments, assured appointments. They don't have to waste their time. They don't have to waste 2 days just trying to see a doctor. They will know who to see. It will benefit.
There are also talks and lectures with doctors, provision of health and hygiene information, and organization of awareness programs and campaigns. This is the first step to creating a health record for every individual in our nation. The database is crucial in the event of emergencies, and it saves villagers time, effort and money in arranging future appointments, consultations and follow-ups with different specialists.
Most of the time, like in India or elsewhere, people lose their prescriptions. They don't once the disease is cured, we hardly remember like where goes the prescription. And if I'm visiting a hospital, if a patient is visiting a hospital, they hardly carry their prescription along on the second visit. So it is beneficial, like only thing that they have to carry is the health card to the hospital or to the doctor. And the doctor has their medical history on the computer.
Another example of using communication and technology effectively for social development and giving many people an easier, happier life. It's the classic tale of the mountain and Muhammad. When we come back